I'm Victoria, and today we are doing our head and neck assessment video. So first we're going to start with checking for the size and symmetry in the face. Your face is symmetrical. And then we are going to check the hair and scalp for lesions, color, and any bugs in the hair while we're looking. So there's no bugs. There are no lesions. The hair isn't coarse. There's pretty even distribution. So for the symmetry of the face, we will check with the nasolabial folds, which are the smile lines, which they are even. And then we will check the alignment of the ears. So the ears should be aligned with the corners of the eyes, which they are. The corner of the eye is aligned with the top of the ear. And then we will also check the palpal fissures, which is the lines when you open and close your eyes. So those are also even. So next we're going to check the trigeminal nerve, which is cranial nerve number 5. So we'll check that by having you tell me if this is even, and you can feel on both sides.
Yes.
And even here?
Yes.
Okay. So, and then we're also going to check the masseter muscles. So have you grit your teeth for me, make sure these are even. Yeah. And then we would also do the corneal reflex, which we're not going to do because that would involve me touching cotton to the corner of your eye to check for reflexes of tearing and closing.
Thank you.
So then we're going to move on to cranial nerve number 7, which is the facial nerve. So for that, I'm going to have you smile for me, make sure that's even. Okay. I'm going to have you then grit your teeth and smile at the same time. Okay. And then raise your eyebrows for me. Even. Close your eyes real tight. Okay. And then also have you puff out your cheeks for me. Okay. Also even on those. And that would also be a taste, which we would have like special papers for, but
Okay.
So then we're going to move on to the lymph nodes. So we will start with the preauriculars, which is going to be in front of the ear. We'll palpate those. Those are very small. And then we're going to move to the postauriculars, which is going to be right behind your ears. Okay. So then we will hit the occipital, which is going to be behind at the base of the skull. Okay. And then tonsillars are going to be at the angle of the jaw, right here. And then we will have the submandibulars, which are going to be underneath the jaw, right along the jawbone. And then the submental, which is in the middle of the chin. We use one finger to palpate that one. And then we have the deep cervical chain, which is under the sternocleidomastoid. So we'll pull the muscle to the side and then feel for that. Okay. And then the superficial cervical chain, which is on top of the sternocleidomastoid. And then we have the posterior cervical chain, which will be right along the edge of the trapezius muscle. Okay. And then we have the supraclavicular, which is going to be hooked under the clavicles. And then lastly, we check the trachea, just to make sure there's no deviation. So no deviation. And while we're assessing the trachea, we're going to look at the thyroid and the cricoid cartilages. So the thyroid cartilages are going to be just above the Adam's apple, so right at the the most extended point of the neck. Right above is your thyroid cartilages. And then find that, and then right below is your cricoid cartilage. So then to assess the tracheal, or the thyroid lobes, what we'll do is we will slightly, from behind, we'll slightly push to one side, have the patient swallow. Okay. Same thing for the other side. Have you swallow again for me? So the thyroid easily moves when she swallows, which is good because it should not be fixed. And then to assess cranial nerve 11, I'll have you shrug your shoulders for me while I push down. Okay. That checks the trapezius muscles. And then turn against my hand. Same. To check the sternocleidomastoids. So that is my head and neck assessment.
Did I pass?